Hello everybody, this is Dr. Willow Ariala coming here almost live, pretty darn close, talking to you today about attachment. Your text discusses John Bowlby. Bowlby is one of the most prominent researchers on the subject of attachment and did some of the earliest research on that subject. And he certainly provided us with a lot of information and the importance and value of understanding attachment, although personally I was not excited that he used infant monkeys in his research. However, getting to the topic, I wanted to share a little bit about why this subject is important and how I've used it in my work as a clinician. I've used it primarily in a couple of roles that I've had, and one of them we actually discuss. We give the people who attend a training information about attachment. So I want to discuss a couple of roles. So one of the first areas that I used the topic of attachment is working with parents in a program called Healthy Start, where I was a clinician and a supervisor in that program. And people who had children were interviewed at the hospital where they gave birth, and they were asked if they wanted to be part of this program, so it was voluntary. It was considered an at-risk program, so for families who met certain criteria, they were considered at risk and invited to participate in this home visiting program. And so everyone who worked in this program received training in the concept of attachment. Many of us already knew quite a bit, but we all received training to have a good understanding of it and how to talk to parents about the value and importance of understanding attachment and how to provide more of a support and foundation for their children so that they could feel more securely attached. So in my role as a home visitor, clinician or supervisor, and also working with other home visitors, we would talk to the parents about attachment, sometimes in kind of general terms, and then give them different activities so that they could help provide or foster a stronger sense of attachment, hopefully, with their children. And so our goal was to lessen the risk that these children would grow up, in this instance, with an insecure or one of the extreme problematic attachment problems. So that was one way that I've utilized the concept and research on attachment in one of my roles. The other one was as a trainer for a program that prospective foster and adoptive parents had to attend, a training that they had to attend in order to fulfill some of their requirements to become a foster or adoptive parent. And in this training, we would hand to them and discuss using case scenarios. And I wish I had the information that I could scan into the computer so that you could see what we used. But we gave them a line graph and had securely attached at one end and extreme avoidant attachment at the other end. And then we had case scenarios where we would talk about different children and some of their situations and how that might have affected their attachment. And so we definitely discussed this with the prospective parents so that they could better understand why perhaps some of the children who came into their home may not have had typical childlike or adolescent-like behaviors, and part of that could have been due to their attachment needs or requirements not being met. And so it definitely could provide some helpful information for these prospective parents. So that was another clinical role that I held in helping people understand the value and importance of attachment. Also, one of the interesting things that I got to, ways that I got to learn about attachment was when I was in my graduate program. In one of the classes that I had, we had a clinician. I forget his specific role or title or field, but he was a clinician working with parents, kids, families, and he did a role play with us that I wish I could do with y'all, because I found it pretty interesting and helpful to understand how attachment disorders can follow a child, a person, throughout their life. So he divided us into pairs or small groups, and some of us were infants, some of us were early childhood up through adulthood. And he would give us a case scenario about a child, an infant who was just born, and some of the challenges that they had in their family, and how their behaviors resulted in some of the challenges that they had in their family. And then he would take us up through early childhood, adolescence, middle childhood, adolescence, early adulthood, and adulthood, to show how the early attachment disorder, if you will, can affect someone in their throughout their life and into adulthood. And so you might reflect on some of the people, children, adolescents, adults you've encountered, and some of their different, odd, abnormal behaviors or reactions to people or situations. And it could be perhaps that one of their influencing factors is not having a secure attachment foundation. So it's definitely a valuable concept. Hopefully you will be able to utilize that in your practice or in just your interactions with people, and it may give you a better understanding of not only other human beings, but perhaps also of yourself. Thank you for your time and attention. Hope this was beneficial for you, and catch you on the next video. Bye!